and good evening once again. Welcome to another edition of Branco Broadcast. I am Bob Branco, and with us this evening, back for a second time after a very good performance in July, we have with us once again Casandra Xavier of Boston. Casandra has another topic she'd like to discuss with you this evening, and so without further ado, welcome back, Casandra Xavier.
Thank you. It's great to be back on Branco Broadcast again. The last show was really, really cool. I'm hoping this one will be just as great or even better than the last. So today I want to talk to you guys about something we may have experience in having happen, but we don't know who to talk to about it. It's the most unknown, mysterious thing known as sleep paralysis, known as old hag syndrome. I have done an academic research study on this back in my days of college in Boston, and the subject resurfaced again among conversations between myself and some other close friends. So I figured I would do another approach to this and bring it to you guys, and I wanted to talk to you guys about this subject and see what you guys hear how you guys feel about it. I guess I would talk about what happened primarily when that first started happening with me.
Please mute your phone. Whoever's coughing, please mute your phone. Go ahead, Casandra.
Okay. So primarily what happened when I first realized this thing called old hag syndrome, known as sleep paralysis, exists, was when I moved to my first apartment in Boston, Massachusetts. That was in Mattapan, probably known as Hyde Park. I was about 6 years old and was just like jumping up and down on the bed, like bouncing around, like fully energized child, like most kids would be. And all of a sudden, I laid down for a couple of seconds, and I realized I couldn't move at all. And I was only able to move my eyes left and right. Still couldn't see much. But the part that scared me was how I was able to hear, people's conversations, but I still could not move for a couple of minutes. And as soon as that cycle broke, I jumped right out of that bed and I hightailed it right out of that room. I didn't understand what that was for several years. And when I was doing my academic research study in college, I learned that it was basically when the brain gets stuck between two stages of sleep, and this other thing that happens is known as rapid eye movement, REM sleep. And when you get that sensation of fear, it's basically, how the body reacts when you are having an episode of sleep paralysis. And the causes of that would be, extreme exhaustion or, pretty much tired beyond belief, but you're not getting enough sleep, or interrupted sleep patterns. So when you finally get to rest, you pretty much trigger an episode for sleep paralysis to become invited. That is the scientific aspect of that. And it's harmless. It doesn't cause anyone any harm. It's just the scariest 3 minutes of your day. So anyone have any questions or anything?
Is there a cure, Casandra?
There are no cures for sleep paralysis other than sleeping well.
Is it related to non-24?
Is it related to non-24? No.
You can't control it then with medicine?
Nope. It's something that happens to all human beings pretty much.
Does it happen more with kids? Because when I was a kid, I used to get, when I read your article, it's like, oh, that's what happened to me when I was a kid. I'd have frozen moments, and I don't have them as much anymore, knock on wood, but when I was a kid, it was like, yeah, I'm awake, but I'm dreaming. I'm frozen in that between, yeah.
Can't get off that spot, and also sleeping on your back triggers an episode as well.
Yeah, that was informative too, because I used to love sleeping on my back, but that's when I noticed it happened the most. So now, but when you explain it in the article, I was like, oh, that's what that is.
So I'm glad that that brought some clarity to that. So sleeping on your back triggers sleep paralysis, and being extremely tired and not sleeping well enough, or being interrupted from your sleep triggers episodes of sleep paralysis. So that's not something that can be easily avoided, but one thing you can avoid is sleeping on your back if you can, you know.
This is Karen.
Hi.
Yes, hi. I had something similar when I was growing up. The only thing I can describe it as, I would have it if I was under stress. I wondered if it, you know, later when I was diagnosed with epilepsy, if it had anything to do with that. But somehow, I don't think so, because what you described as, you know, it would happen if I'd stay awake for a few hours and my sleep was interrupted, or it would happen if I was under stress, or yes, it would happen if I slept in my back sometimes. And what would happen is I'd hear voices. It would be like I'd be almost in a dream state. And I'd have these weird dreams as if something was tickling me or something. And then I'd wake myself out of it. And I found that if I moved enough, I'd go back into a regular sleep. And it has dissipated with age. It's dissipated.
Oh, yes. When you get older, it goes in between young ages up until into your 60s, 60s to 70s. But if it goes on beyond that time, it can be related to other conditions that I may not have touched base on during my studies on sleep paralysis. Right. And I've seen CT scans of the brain, digital scans of how the brain reacts to sleep paralysis episodes. The brain looks like fireworks. It's like a firework because when that happens, the fluid around the spinal cord and the brain, actually the fluid around the brain slides down into the spinal cord area, and it disables physical movement so that you are not reenacting your dreams or nightmares. Usually nightmares in sleep paralysis episodes.
Yeah.
Yes.
Casandra,
Yes.
I just wanted to ask you, are you partially sighted or are you fully sighted or what?
I am low partial since birth.
But you can see enough to see what the brain looks like?
Yes. It was on a large screen and I got up close.
That sounds fascinating.
Bob?
Yeah, go right ahead, Don.
Okay. I wasn't sure whether I was unmuted or not. Yeah, okay. Casandra, I've never experienced sleep paralysis, but I have experienced something that's pretty common. It's between being awake and being asleep. It's called the lucid state.
Lucid dream?
Right, yeah, and right before you go to sleep, you're suddenly awakened by a sudden jerk of your body.
Yes.
Yeah, and sometimes you hear a loud snapping sound.
Yes.
That's happened to me a few times. That's common. Has that ever happened?
Yes, it is. I can attest to that.
Oh, yeah.
Yeah.
That is very common. I've had a lot of these things happening, but lucid dreaming can actually be induced. You can actually trigger that yourself.
Yep.
With a high concentrated meditation. Whereas
it's weird too because you know that you're dreaming, but yet you're half awake. And that sudden jerk of your body, and you hear that snapping sound. In some cases, not all, but some, the person would experience an OBE. Which is an out-of-body experience. Now, that I have never had, but I've had these other things that I've mentioned. Have you ever had an OBE?
I actually have, in fact. I have had
no kidding.
I have. I had.
No kidding, really.
Seriously. This is why the subject was that much more interesting to write about.
Yeah.
I have had an out-of-body experience when I was 17 and 15. These were during medical procedures, like surgeries. I wrote an academic essay about near-death experiences, and I had to back all of that up with scientific research to prove that it was real, because whenever I mention that subject, people say that it came out of the subject matter of parapsychology. And I basically broke it down for them in the academic research. So yes, the out-of-body experiences are absolutely real, and there is scientific research to back it up. I got all that information at the Massachusetts General Hospital from, like old templates of episodes of people reporting that. So out-of-body experiences is basically the brain, especially in traumatic situations, fight or flight stages is what your brain experiences, giving you the illusion that you are quote-unquote dying. But it's basically the brain deciding whether or not to be still functioning or to just die during the event of a traumatic situation. But my experience was during a surgery I was having, and I had recalled seeing my mother yelling at the doctor, telling him to fix the disaster he came over to give her, that I was having problems with surgery, and that they were trying to do their best to get me back to speed. And I saw the outside of the Mass Eye mirror, and I saw myself laying on the bed with a bunch of wires hanging out. I looked like a human squid, and I did not look like myself because of the swelling from the surgery on that side of my face.
Oh,
but
right.
Back to myself, I was in so much physical pain and so tired. It was like being body slammed after that out-of-body experience, or NDE, as I would call it, near-death experience of some sort.
I've had dreams, not near death, but I would leave my body. Some of them were more like lucid dreaming, so I don't think it was trauma, but it was like a dream where I would consciously say I want to leave and go travel, like I guess you said meditation and all that. But you feel the sense that you're leaving your body, but it wasn't because it was trauma. It was more of a dream, just having the dreams about it.
Yeah, like you feel like you're going on some kind of slide and you're just like zipping around all these places, like zip, 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 all quick and cool and everything.
Yeah, right.
That seems to be pretty cool and like harmless. But then you wonder, like, did you really leave yourself?
Well, Bob, may I say something?
Yeah.
Yes, go ahead.
This is Joni. I spoke a little bit before. When I was a child, up to a few years ago, I would have the experience of lying in bed, going to sleep, and then feeling myself rising from the bed. I knew that my body was on the bed, but I felt like I was going up, up, up. And I said to myself, now if I don't move, I'm going to stay up there. And I would be flying around. It was the most wonderful feeling. I always
that was
loved
Tony, I think.
Definitely out of body. Yeah.
Yeah.
And I always kept wishing that I would have more of them. I remember having them in college, and I never felt so good. I mean, it was just wonderful. But I never told anybody that I had them. And just a few years ago, I don't know who I was talking to, and I said, I have these things. I haven't had them for a long time. But when I had them, it was the most wonderful feeling because I was flying above everything and not afraid to move, but wanting to move and wanting to hold on to the situation, and then kind of floating, and then going down, 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 and quietly going back on the bed. And they said, that's an out-of-body experience. I said, it is? because I always heard about out-of-body experiences, but I didn't know what that was. I just loved it. I still wish that I could get myself into it and have one tonight.
So have you
some
studied...
of those experiences can be really good, and some can be scary.
Yeah. Have you studied
they
lucid
do
dreaming?
go hand in hand with the near-death experience. I'm well versed on NDEs. I've heard there's so many talk shows on them. They were researched exhaustively, and OBEs seem to go hand in hand with NDEs.
Definitely.
Yes, they do. Yeah.
I met a very renowned Native American surgeon, Dr. Lori Arvizo Alvord, at my college, and the best advice she said, the best suggestion she gave for folks that were going into surgery and were afraid that they would have those experiences again was that you never go into an operating room with negative feelings or negative thoughts.
Oh, no.
You always go in with a positive thought mindset. Not think about anything negative at all. Because when you do that, you pretty much harbor some kind of negative vibes to go under with you. And that was the best piece of advice that Dr. Albert gave to me when I met her in person.
Yeah. Have you studied lucid dreaming at all, Casandra?
I've touched on it a little bit.
Yeah. I know some of the psychologists don't believe in it, but I'd like to research that.
It's a touchy subject, though, because when you go online and you look up stuff about lucid dreaming, you get a lot of people that don't have a lot of credible sources behind it.
Oh, yeah. I'd have to...
So it's always good to go with credible sources, as I've done during my... Yeah.
Okay, anyone else? Anyone else? Ed, do you have a question for Casandra?
Still there?
Well, lucid dreaming, I believe it. Because sometimes I remember dreams that I've had quite vividly, and other times I remember them when I have them, and then they just fade away and I don't remember them anymore.
Yep.
Yeah, some of them are like that.
Like controlling your dream, like you say, I know I'm dreaming, so it's not going to be a nightmare. I don't.
Yeah, that's exactly right, Steve.
That's what I'm talking about.
In lucid dreaming, you're half awake and half asleep.
Yeah. So
and you know that you're dreaming. It's really weird.
I know.
I've had them a few times. And I had one just this past week when I was up in northern Maine at my stepdaughter's house. I was half asleep, and I was walking to the bathroom, and I closed it. I said, "This is odd. I'm not even awake." And it was kind of like a lucid dream kind of feeling. I knew I wasn't awake.
Yeah.
Well, when I was a child, I could not believe when I had my dreams. Well, during my whole life, my dreams always have been very, very vivid, extremely vivid. And when I was, I don't know, maybe 4 or 5 years old, and I remember this, I had a dream that I was in the bathtub, and I heard this voice saying, "Goodbye, I'm going down the drain." And I was so afraid that I was going down the drain, and it stayed with me my whole life. I never forgot that. And I've had a lot of dreams like that, and I could not, when I was little, I thought the things were really happening.
Yeah.
I was so convinced, and my parents would say, "Oh, you're okay, it's a dream. It didn't really happen." "Oh, yes, it did. I was there. And I insisted that I was there, and it really was happening."
Yeah.
There's a few of us here online who had sight before. And me, I'm totally blind now, but I had partial sight when I was a teenager, and I still dream in the visual sense.
Yeah, you know what's funny about that is I only dream what I could see, what I can see or could see. Like I never dreamed seeing out of my right eye because I never saw out of my right eye. So it's
Same
really
here.
weird. Yeah, it's really weird. So I guess.
And I'm totally blind, and I have never really seen anything in a dream, but I always know. It's like my regular life. I know where everything is. I know what's going on as far as, like, the visuals. I know that there's a stairwell in a place, or I know that I'm at a door and there are other people on the other side of the door. I know everything, but it's not through visual means because I've never seen.
Mm-hmm.
And the sighted people are always really fascinated about the way I dream. Nobody could ever figure out because sighted people see in their dreams, and we don't. But I hear, I smell, I taste.
Yeah. I've had some of the best food in my dreams.
Oh, know it.
And I dream in color. I mean, people say, do you dream in color? It's like, yeah, why not? You know, if I could see color, I dream in color.
Yeah, I do too, Steve.
Yeah, you
because I had,
right? Yeah.
because I had partial sight at one time.
Yeah.
So
it makes a difference when you have sight.
Yeah, it does, Joni. Yeah, it does. Yeah.
Well, guys, I fell asleep without the mask, and it was another world just now.
Dream.
Well, no, it's you know, if you have that sleep apnea and you fall asleep more than 20 minutes.
Right.
So it's like I'm in another world. And when I wake up, I feel like
I'm gonna use my mask for the first time tonight.
Oh, you are?
Yep.
Did you get a full mask?
It covers my nose and sort of down
You
to
lower
my chin, but it doesn't cover my chin.
Okay.
Oh, so you got the nose pillows, Joni?
No, she got a full mask. No, she wouldn't.
Small, because he said I have a small face.
Yeah, you got to meet.
Oh, okay. Okay, because there's several kinds of contraptions.
I know.
Yeah.
Yeah, there's the full mask and there's the nose pillows.
Yeah, there's so many different masks.
I'll get back to you, Sandra, and ask you do you know if there is a physical danger to this problem that you described this evening?
No. There are no physical dangers within sleep paralysis, except that only physical danger is when you wake up from the episode and you don't go to sleep. That leaves you furthermore sleep deprived.
The reason I'm asking is because I've heard of a lot of sleep apnea cases, and I know that's not what we're talking about tonight. But sleep apnea, you've got to wear a mask a lot. There's a breathing issue if it's not addressed. So I didn't know whether this was another example of that.
No.
Okay, thank you. Anyone else? Don, go ahead.
Do you still experience sleep paralysis from time to time nowadays?
Yeah. I still get those episodes every now and then. It mainly happens, especially when I'm extremely exhausted.
Oh, yeah.
Or if I have one of those nights or a few days where sleep is really and I keep getting interrupted from my sleep, those episodes would trigger, especially if I go to take a nap during the day from being extremely tired earlier that morning. Yeah, it's likely to trigger an episode.
Uh-huh.
But I know it's not going to cause me any harm, so I just
no.
I just disturb the 3-minute cycle. Basically, the best way to interrupt the cycle is to begin breathing deeply. Now, what happens during that episode is where your breathing is restricted because the muscles are controlled by your brain to, like, absolutely just totally relax themselves. It's like being in an episode of being forced to fall asleep. And breathing is restricted, even if you know you didn't sleep with anything on your chest. But for those 3 minutes, you are going to need to take as many deep breaths as you can.
Mm-hmm.
Now, what if you add pillows, when you go to sleep to an angle, like put yourself on 2 pillows?
Yeah.
Or 3, do you think that would make a difference?
It wouldn't matter. In sleep paralysis, sometimes you can get them on your side, too. Oh, yeah, they get you on any angle you sleep on. Even if you're sitting up sleeping on a recliner, you can get it there, too.
Yeah.
Now, you must have heard of non-24, and I'm wondering if this sleep paralysis is a symptom of non-24 based on the way you described it and the way that some of us can relate to it. And we all know, what non-24 is by now and why it exists, at least as far as the blind community is concerned, so they say. So if I'm to be correct on this, you got doctors out there prescribing meds for non-24, which I don't think they should. So I'm wondering if that's a direction that we shouldn't even go in.
Probably. I'm not sure. I mean, I've heard of non-24, but I don't think that would be the direction that it would go in.
Because as far as non-24 is concerned, in my opinion, and I'm sure that others would disagree, I feel that that's something that if you can control it, you would be able to. And that I don't know if a medication necessarily would help it. If it does help somebody, that's great. But I'm just wondering if it's a necessary thing to do for non-24.
I think they invented the drug or invented the disease to prescribe a new drug. Because I went to a talk on that at Perkins. It was very enlightening. These guys are saying, sighted people can get non-24. Because I wasn't even going to go because I thought, only totally blind people get it. And they're saying, if you're partially sighted, you should go because you can get it too. And it's like everyone has trouble sleeping from time to time. But I'm not an expert on it. But it sounded really interesting when they're saying sighted people get non-24.
Well, Steve, the official story about non-24, the way I understand it, is that not enough light comes through the eyes of a blind person to regulate the waking hours. And that's why blind people are more known to have it.
That's what I heard until I went to that talk at Perkins.
I've heard of that too.
And they're pushing an orphan drug to prescribe to non-24 patients. That's my opinion, but.
Well, I think Vanda Pharmaceutical kind of took this and started doing studies, and it's a drug that they can make money with, and that's what it's really about with them. I think that it started with good intentions, but the drug that they are prescribing to people has a lot of different side effects that, my doctor said don't take it. I'm doing well with melatonin, and hopefully my sleep will improve with the mask, sleep apnea, which I never knew I had. But the non-24, they don't really tell you that if you're over 65, you shouldn't take it. You'll have bad nightmares. Your liver can be affected. Your kidneys can be affected. Who needs that?
Do you know what they're prescribing for it?
Yeah, they have, I forget what the name of it, Hipla or something, I don't know.
Yeah.
Yeah, they came up with a drug, and when they were doing the studies, in the very beginning, when the doctor from Harvard was doing the studies, they were paying people like $8,000 to spend a couple months in Boston so that they could study them. And then Vanda Pharmaceuticals got a hold of it, and you see it all over TV. And
Yeah.
it's I don't think it's a good idea. Now maybe if you're young, now look at Mike Lance. He was taking it, and he was having problems, but he kept going back to the doctors, and they said, take it. Keep on taking it.
Wow.
And it costs a lot of money. They don't give it to you.
No.
Yeah, and this is Lauren. I know that Audley took it for a while, and she had a lot of problems with it, and she went off it right away and went back to melatonin. And I've heard also that it can cause seizures.
Oh, brother.
Oh, brother, you don't want that.
Oh,
No.
brother.
Well, melatonin is kind of harmless.
Yes.
I'm taking, I think I'm taking 10 milligrams now every night.
Mm-hmm.
And sometimes it works, sometimes it doesn't. But it's an over-the-counter thing, and it's good. I mean, at least I can get to sleep, except on nights when I can't get to sleep.
Mm-hmm.
I mean, I never was diagnosed, but I know that I have non-24. Because I'd much rather sleep in the
Audley
day.
does that too. She takes the melatonin, but that the medicine that they had recommended for could cause seizures. That was one of the side effects.
I forgot about that being a side effect, but that's true.
Mm-hmm.
Cassandra, I have a question for you. Are you still there?
Yes.
Okay. Has anybody ever approached you about doing a sleep study?
No, I have not been asked about a sleep study. Because when I talked about it, and I said it doesn't happen very often, but I remember each time it does, mostly, it was just pretty much discounted as like, typical person who sometimes has problems with sleep, but most times can sleep okay through the night.
Well, I think now they do sleep studies to find out if you have sleep apnea or not.
Yeah, that's the biggest reason. But yeah.
And it's not fun. It really is not fun. I had 2 of them, and because the first one, they wanted to know some things, and the second one, they wanted to know some other things. And
It's pretty fun.
It's just, you're in a strange bed, in a strange room. Every time I...
Stuff with wires, too, Joni.
Oh, yeah, there's all kinds.
You're all
wires. And they put this gel in your hair.
Oh, yeah.
And, oh, my God. I had to shampoo my hair 5 times the next morning to get all this gunk out of my hair.
Oh.
You mentioned a gel in the hair. I have dreadlocks. I can't have nothing in my hair like that. Nope.
Well, then they couldn't do it because they hook up electrodes to your head. And I said, do you have to use all that gel? He said, well, it's not that much. He said, and you can get it out of your hair. Oh, yeah? So the next time I went, I had a haircut, and I had my hair cut real short. Because I said, I don't have long hair, but I'm not going to go through this stuff again. Oh, my God, no. 4 shampoos and still couldn't get it all out.
Yeah. Yeah, I remember when I was a kid, they gave me a brainwave, but that stuff was in my hair. It was like, oh, my God.
I don't mean to laugh, guys.
That's all right.
I mean, I've been through it so much.
That's when it's like, oh, okay.
You're someone who's got dreadlocks all the way down their back. You cannot have just anything going in your hair because that's like several hours of washing and conditioning.
Yeah.
I don't even know what dreadlocks are.
It's locked hair that just grows and you continue to like maintain and twist. You wash it like regular hair.
Isn't that what they call a lazy hairdo?
No.
Anyone else? We'll take a couple more questions before we wrap up.
Somebody's got a...
Casandra, we appreciate you being on, sharing your experience about sleep paralysis. I've learned that this is more common than I thought, that I probably have it. You know,
yeah,
because I can relate to lucid dreams, I can relate to semi-sleep, I can relate to all that pretty well. So what you've discussed, as far as I'm concerned, is very common amongst a lot of people.
Oh, yeah.
So we thank you for sharing that with us and enlightening us again about your issues, and thanks for being on the program this evening.
Thanks for having me.
Not a problem. It's my pleasure. Have a wonderful week, everyone.
Thank you, Casandra.